Did you know that more than 80% of people who use baking soda have no idea about its most powerful health secrets? That's right. This common kitchen staple, something that costs just a few cents per dose, is quietly sitting in millions of homes, hiding its real potential. In fact, many health experts refer to baking soda as one of the most overlooked remedies on earth. Think about it. How many times have you used baking soda to freshen up your fridge or bake a cake without ever wondering what else it could do for your body? What if I told you that this simple white powder has a long and fascinating history of surprising uses, some of which could completely change the way you care for your health in your senior years? Why don't more people talk about the true power of baking soda? And more importantly, what might we all be missing out on? In this guide, we'll explore the little-known health benefits of baking soda, reveal who should be cautious, and explain exactly how to use it safely and effectively. If you care about your health and want smart, natural options, you won't want to miss this. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Relieve heartburn and acid reflux. For many seniors, heartburn has become such a frequent companion that it's almost accepted as a part of aging. After meals, especially in the evening, that familiar burning sensation rises behind the breastbone, traveling up toward the throat. It disturbs our sleep, sours our mood, and often leads us to reach for antacids without even thinking. But what if one of the gentlest and most effective remedies has been quietly waiting in your kitchen cabinet all along? Baking soda, that simple white powder used in baking or to keep the fridge fresh, holds a powerful natural ability to neutralize stomach acid. When mixed with water, it becomes an alkaline solution that quickly calms the fire of acid reflux. This is not just folklore or old wives' wisdom. It's chemistry at its most practical. When baking soda, sodium bicarbonate, meets excess hydrochloric acid in your stomach, it forms salt, water, and carbon dioxide. In other words, it stops the burn. Within minutes, that pressure in your chest softens. The rising acid that once irritated your esophagus fades, and your breath comes easier. But perhaps more important than the science is what this simple solution represents: a chance to feel comfort again without relying on pills or prescriptions. For seniors already managing multiple medications, the ability to use something natural, familiar, and affordable feels like reclaiming a bit of control. No pharmacy trip, no side effects, just a moment of peace delivered through a teaspoon and a glass of water. However, it's not for every day, and it's not for everyone. Baking soda contains sodium, which may not be suitable for those with high blood pressure, kidney issues, or heart conditions. But for occasional relief, especially after a rich dinner or when you lie down too soon after eating, it offers a kind, fast-acting remedy. Imagine ending your evening with a warm drink, knowing that your body is easing into rest rather than preparing for discomfort. That's the quiet magic of this humble solution, not only in what it does, but how gently it does it. 6. And as powerful as that relief can be, it's only the beginning of what baking soda water might do for your well-being, because the same drink that soothes your stomach may also be quietly supporting your kidneys, the silent workers of your body, tirelessly filtering every drop of blood. Curious how that works? Let's uncover the connection between baking soda and kidney health and what every senior should know about protecting these vital organs. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Support kidney function. As we grow older, we become more aware of the quiet systems in our body that have been faithfully working behind the scenes for decades. Among them, our kidneys play one of the most vital roles, filtering waste, balancing fluids, and helping maintain the delicate acid-alkaline balance that keeps every organ running smoothly. Yet with age, And especially in the presence of chronic conditions like diabetes or high blood pressure, our kidneys begin to lose efficiency. The changes can be subtle at first: fatigue, swelling in the ankles, or changes in urination. But they speak of a deeper imbalance that needs care, not silence. This is where baking soda, a simple household item, enters the conversation in an unexpected way. Research in recent years has shown that baking soda, or more precisely sodium bicarbonate, may offer meaningful support for those with early stage chronic kidney disease, CKD. How? It all comes down to acid. As kidney function declines, the body can struggle to remove acid from the bloodstream, leading to a state known as metabolic acidosis. This condition quietly accelerates kidney damage, causing a vicious cycle of decline. When taken in small, medically guided amounts, baking soda acts as a buffer, helping neutralize this excess acid. It doesn't just offer momentary relief, it may slow the progression of kidney disease. One long-term study found that patients with CKD who were given sodium bicarbonate supplements experienced a slower decline in kidney function, and many avoided the need for dialysis altogether. That's not just science, that's a second chance, a way to extend independence, avoid invasive treatments, and continue enjoying the rhythms of daily life. Imagine giving your kidneys a gentle hand, not through drugs, but through something as familiar as water and a spoonful of powder. For many seniors, especially those managing multiple prescriptions, the idea of supporting health with something natural and low cost brings both peace and hope. Of course, it must be used with wisdom. Baking soda contains sodium, and for those with advanced kidney disease, heart failure, or fluid retention, caution is essential. Any regular use should be discussed with your healthcare provider because the goal is support, not strain. Still, in the quiet work of protecting your body's internal balance, this simple remedy offers surprising potential. And it doesn't stop there. While baking soda helps your kidneys manage acids, it may also ease one of the most painful and frustrating problems seniors face: urinary tract infections. Could this kitchen staple really calm that burning, urgent discomfort? You might be surprised by what the research says and what you can do at home to feel relief. Let's explore it next. 3. Ease urinary tract discomfort, UTI support. Few discomforts in later life are as disruptive and draining as a urinary tract infection. For many seniors, especially women, that burning sensation, frequent urge to urinate, and nagging pelvic discomfort become unwelcome visitors that show up again and again. UTIs don't just make the body uncomfortable, they also chip away at dignity, sleep, and peace of mind. And while antibiotics remain the primary treatment, what happens when symptoms linger between infections? What if something simple could gently ease the discomfort, even if just a little? That's where baking soda comes in, not as a cure, but as a soft and supportive ally. When dissolved in water, baking soda becomes alkaline, raising the pH of your urine. This change may not seem dramatic, but it can shift the internal environment just enough to make it less welcoming for the bacteria that cause infection, particularly E. coli, which thrives in acidic conditions. Seniors with recurring UTIs often live with subtle inflammation, even when a full infection isn't present. A more alkaline urinary tract may reduce irritation and soothe that daily discomfort that doctors sometimes overlook. Science has begun to echo what many people have discovered through personal experience. In one study, women with frequent UTIs who use sodium bicarbonate as part of their care plan experienced fewer flare-ups and reported less burning and urgency. It's a humble change, half a teaspoon stirred into a glass of warm water, but it can feel like a small restoration of control when your body feels unpredictable. More than just changing chemistry, this small act can bring comfort during an anxious time. It gives seniors something immediate they can do to feel better while waiting for an appointment or in between courses of treatment. It offers a sense of relief without depending on yet another prescription. And in a world where older adults often juggle multiple medications, that alone can bring peace. Of course, this is not a replacement for medical care. UTIs can worsen quickly in older adults, especially those with diabetes or catheter use, and must be treated seriously. But for occasional support, and especially under medical guidance, baking soda water may be a gentle companion on the path to recovery. And while it's already comforting to know that baking soda may ease internal discomfort, its usefulness doesn't stop there. Because believe it or not, the same mixture that soothes your urinary tract may also help quiet those painful flare-ups of gout that strike the joints without warning. Could this same kitchen remedy really soften something as intense as gout pain? The answer may surprise you. Let's take a closer look. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. Help with gout flares. If you've ever woken up in the middle of the night to a joint so swollen, red and painful that even the weight of a bedsheet feels unbearable, you know the cruel nature of gout. It's not just pain. It's the kind of sharp, stabbing discomfort that hijacks your daily life, often striking without warning. For many seniors, gout feels like a betrayal of the body, especially when they've worked hard to eat better, stay active, and follow doctor's orders. And yet, the flares still come. At the heart of gout is uric acid, a substance that builds up in the blood and crystallizes in the joints, most commonly in the big toe, ankle, or knee. These tiny crystals feel like glass shards under the skin, triggering the immune system to react with intense inflammation. The solution isn't simple, and medications certainly have their place. But what if you could do something gentle, at home, to support your body in reducing the frequency or severity of these attacks?